my advice is choose well what you are doing. Choose well where you are going. Please, don't lose any chance to learn a course, a new course, to learn any new skill any year.
Hello everybody, this is Alex Terra from The Set, and you're listening to The Setback. And we're very excited to welcome our guest for today's podcast, Dr. Peter Kwizera. He's a medical doctor specializing in public health, policy, and management. He has more than 17 years experience working in clinical management in different hospitals in Burundi and abroad.
Thank you, Alexi, for inviting me. I was happy to hear that I was invited, and always when I'm invited, I feel glad to be welcomed and then to give my experience, to give my testimonies. And also that can help the community or anyone, young people or other people who may need my encouragement. My name is Dr. Peter. I'm officially 50 years old.
Mm-hmm. Officially,
I mean, because on my ID it's 48.
Oh.
Then the reason was primary schools were not as many people were needing to attend by then. Then I was looking very young. And then they sent me back. 1981, maybe you were not born.
1991, I was born.
81.
81? Oh, 81, yeah.
So you were not born, I can't see.
I wasn't born yet, yeah.
Then coming to university, the first year, I passed easily. But the second year, I failed. Mm-hmm. Then I was, okay.
That's university, by the way.
That's university.
You were doing...
the Faculty of Medicine.
Oh, okay, before that. Tell us before you could start university or going to the Faculty of Medicine or what. There were maybe a lot of faculties, not only medicine. I would like to know what was the reason or any motivation that pushed you to go for medicine. Why did you go for that medicine, not other faculties? Any reason behind?
Oh, that's a good question. Mm-hmm. Because I think, first of all, I have to tell you that during our time, it was a lot of faculties, and medicine was not the first choice for many. The reason was that you finish medicine after 7 years, you are not well paid. Mm-hmm. Like it was, for me, it was only the passion that pushed me
to go for medicine.
To go for medicine. Because, by the way, okay, let me tell you, when I finished medicine, a medical doctor could gain around 110,000 Burundian francs.
By then?
By then. Oh. But there were other faculties where people were...
Like
the economics.
Mm-hmm.
Well, because we know, okay, when you finish economics, you become a director, general somewhere, immediately. Passion was...
That drove you to go for
That's
medicine,
what drove me to go to medicine. Mm-hmm. Otherwise, there was no other reason.
Mm-hmm. That journey, that path, up to today, and everything, the career path, difficulties, what you loved or didn't love, the setbacks.
For me, I have now, I think, more than 17 years work experience. I finished by 2007. Worked in many hospitals as a clinician, as a physician. Working there, the most difficult part from that time, when I was working in the hospitals, it was lack of equipment. Mm-hmm. You are freshly coming from the school, having the passion to serve, working in the hospitals where we have a lack of equipment, supplies, and then that's where most of the challenges when you think, okay, you have a case which needs a specialist, mm-hmm. but let me talk of neurosurgeons. We didn't have any neurosurgeons, for example. When you are there...
Who are they, by the way? What do they do, the neurosurgeons?
You know the brain? the one who can operate and
the
then
brain.
open the
brain.
skull and then enter in the brain and then so we have
these are the ones who do brain surgery. Okay.
So that's one case I can give. And then so you can imagine you're in a hospital, there is a case you can't manage. Then when you need for referral to another hospital, you think, okay, which hospital to refer to?
Is there any improvement? Because comparing that time and today, like brain surgery or everything?
Yes, I can say yes, even though we have not attained the level.
Where we're heading?
Yes, where I think Burundi could go.
Yeah.
But I can appreciate there have been a big improvement. You can also imagine, may remember, during that 2010, Bujumbura was having, I think, a little number of hospitals. Now there are new hospitals, Kira Hospital, Tanganyika Care Hospital, among others.
Yeah.
Even in rural areas, we have now regional hospitals. But we still have a big issue of equipment.
What's the good thing of doing something that you love or passionate about? Tell us, in terms of results, the two persons, one is driven by money and the other is passionate about that work. What difference between the two in terms of results?
Thank you so much. There is a big difference between somebody who is driven by money and somebody who is driven by passion. From my experience, I can say the results are very different. Let me give you one example. It's when I was working at the Clinic Prince Rwigwagasore in the maternity ward. We were only 2 medical doctors. You can imagine when you have to work in the ward, you work in the consultation room, you go for emergency, you go for cesarean section, you go for a parotomy, and sometimes when you are about to reach home,
the phone call telling you come back here.
There is an emergency here in the. Then, if for example you are driven by money, you could say, okay, this is my time to rest. Why should I go back? I'm not a machine to continue, but when you are driven by the passion,
you go back.
You go back.
Take care.
Take care.
Yeah.
Sometimes when there is an emergency, one doctor, there are 2 emergencies coming at the same time. And you are not on duty. But you receive a call at 2 a.m. in the family saying, okay, there are 2 emergencies and you have only 1 doctor. Could you say I'm not on duty? Could you say, well, would you pay me again? But when you are driven by passion, you go freely.
You intervene quickly.
Intervene quickly. You go and do it without asking any of those. But let me tell you,
you have to save somebody's life before and do that quickly.
Don't think even outside the boundaries and saying, okay, I could be considered. By the way, the big issue is frustration. When you are doing what you don't like, when you are doing what you don't love, people will be frustrated. The quality of work will be low. Then, but when you are driven by passion, when you are doing what you like, anything can happen. But the person will be happy. Now, I've seen many people, many young people choosing their career path or their studies just when they are looking at, okay, that person has done that faculty and he's now getting enough money. Many people got frustrated because when they didn't choose well the career path before, all things can change, as I said. If it changes, those people will be frustrated, will not do well. So my advice is choose well what you are doing. Choose well where you are going. Because, for example, if I'm doing what I like, having money or not, I'll be happy and life will be easy. Life full of frustrated, it's not life. It's another hell on earth.
Is that easy to find what you love? Because I don't think it is easy to know what you love, or at some point in time you can need somebody else to help you find what you love.
I think it's not easy to know what to love or what you like. But sometimes if there is a mentor can also follow you. In other countries, mentorship is very interesting when somebody has a person or a friend, family member, or somebody else. When looking at the person, what the person is doing, when he's doing something, can testify and say, okay, this is what you like. But why was, because some people would say, if you have a medical degree, you are above all degrees, and then you could, then when I finished the medical degree, that's where I understood I've done nothing.
That there was still a long way to go.
Yes, good to learn foreign languages. I've seen people here in Burundi learning German, and it's very important. People would say, okay, we know only French, we know only English, but any foreign language is an added value to your career path, because from the US, wherever you apply, it's easy. I can apply in French countries, Anglophone countries. I even applied for UN, by the way, to say I have practiced. And then I had also to go to some hospitals, maybe not saying as a physician, but as a public health expert. In Montana, I had to visit a hospital there for public health issues and expertise. In Montana, I had also to visit Emory Hospital for public health expertise, not as a physician. So I practiced there. But then I saw they have everything. I said, okay, what will be my contribution if I stay? I was working in South Sudan for UNHCR.
Oh, okay.
So, South Sudan, they are speaking English.
Okay.
I could not apply there if I didn't learn English. That's another
asset.
That's why from there I can advise young people to think about
foreign languages.
English,
some French, some Spanish.
Any
course
can give you a breakthrough somewhere. Because in many countries are looking for professionals. Can't have a professional career in a country where you can't speak their language.
That's
so it's a very interesting, and anybody can encourage anyone to have a second foreign language or third or fourth. I did another master's degree online. This is to say for young people, okay, can somebody old continue keep on learning. Sincerely, I'm among people who can say, please, don't lose any chance to learn a language, to learn a course, a new course, to learn any new thing, new skill any year. Because if you want, as I said, your career will succeed when you have always French, Spanish, English, or whatever. And then whatever skill is in your path, please, can take it.